stop doing the freebies that we all do. Now, our guest speaker, Patricia, is a dual registered pharmacist and nurse with an impressive and diverse background spanning through community pharmacy, general practice, and integrated care. She qualified as a pharmacist in 1998. So when we say she has a lot of experience, we mean it. She's worked for Boots as a pre-reg and a pharmacist, and then moved on to Day Lewis, where she developed further her skill and completed her independent prescriber course. Following on to this, she went into work in general practice, working both as a practice pharmacist and a practice nurse. This dual role had helped her develop specialization in long-term management, such as asthma, COPD, and diabetes. She worked both at the pharmacy and nursing, and she has always been driving the passion in both professions. 5 years ago, she decided to return to community pharmacy, and she acquired a pharmacy about 2 months before we went into lockdown. But her resilience really made her work incredibly hard so her business could adapt and survive through the early months of COVID. Her extensive experience, both in community and in the clinical setting, has shaped her mission to bridge the gap between pharmacy and primary care and to champion fair funding. So without further ado, Patricia, over to you. Tell us how we're going to not continue doing freebies.
Good evening, Olivia. Thank you very much for that very kind and generous introduction. So I had a request by the MPA to basically share my experiences about really navigating this challenging times that we're in community pharmacy. And initially, I sort of hesitated because I wasn't quite sure what sort of information I would be able to share with everyone. But as the months and the weeks went by, I realized that it was really something that I'd had lots of conversations about with colleagues, with fellow contractors, you know, and quite a few, I think I've seen a few of your names here, female contractors in leadership as well. So I realized that actually was a topic that was not only one that I was very passionate about, but one that a lot of my fellow contractors are passionate about. And I did want to have a very, very kind title, transitioning from free to paid services. And I thought, actually, we really have got to be a bit more gutso about how we're dealing with the situation in which we are. And free no more seemed to be a very apt, you know, sort of title for what we're going to do. So really, what are we going to be doing? We're going to be looking at how we sort of stop giving these freebies that we do on a day-to-day and actually try and make that pay. How would that make it pay? We'll see that as we go along. But I'm hoping that as the time, you know, sort of goes on this evening, I'll be able to share with you some of the things that I have been able to do to try and get myself to be paid for the time that I spend within the pharmacy. So Olivia has already told you who I am. I am a contractor. I'm also an independent prescriber, and some of the things that I do on my day-to-day job are run a travel clinic. I'm also a COVID vaccination site lead. I did have an interest in anticoagulation, and so ran a warfarin clinic for a number of years, about 7 years or so, while I worked in Day Lewis. And then, of course, I went on to do my prescribing course, which led me to actually specialize in asthma and COPD and diabetes. Some of the work that I did in Day Lewis is what actually earned a Clinical Services Award in 2016, where we won the award for the warfarin clinic that I was actually running with a few other pharmacies within the Lewisham area. Now, when it comes to clinical services, yes, I have got a background in nursing, and I think that made it quite easy for me to sort of almost transition to doing that. But I think it's something that we've all, as pharmacists now, have to learn to do. So we're delivering flu vaccinations at a level that we never delivered before. I remember my first encounter with delivering flu vaccinations when I started work in the Lewisham area was the pilot that Greenwich CCG, or probably PCT, ran then, and in the first year managed to about scrape 50 vaccinations, and that sort of almost trebled year on year. So it's something that we've all gotten a little bit used to. So I'm hoping that as we go along, you can see how you can use those skills that you've acquired, similar to what I had acquired throughout my career, to be able to do what we're doing now. I also am a vice chair of the Southeast London LPC. I'm not coming in that capacity at all. It's just a hat that I wear, but I think it's important to declare that. I am a member of the Community Pharmacy Expert Advisory Group for the RPS, and we sort of get together every couple of months or so and really look at issues and things that are relevant to community pharmacy and try and help to direct how change happens. I'm also a community pharmacy neighborhood lead for the Eltham Health PCN. So that is the experience that I'm going to be bringing to you today.
Patricia, if I can, just before you start, so I'm going to let you present all the way to the end.
Yes.
And I'm going to ask all the delegates this evening to put any questions they have in the chat. I will make a note of those. We will cover those questions at the end. So I'm hoping everyone can be on mute and then we can have a chat at the end, if that's okay. All right? Thank you.
So why do we need to do this? Olivia already alluded to a lot of the sessions that we've had. The MPS really quite kindly organized for us. We are in challenging times, and one of the most recent ones was the masterclass that was run by Mike Hewitson. I'm hoping that a lot of you actually attended that. Really, which was basically getting under the bonnet of the pharmacy contracts, was to allow us contractors to really think about what this pharmacy contract means for us today, and also understand the nuances of it and how that is actually affecting what we feel today, which basically is the financial pinch that we feel with running our pharmacies. So the recap: a decade ago, funding cuts began and it hasn't stopped. It's been relentless. We're yet to have a pharmacy contract agreed for 2024-25, let alone for 2025-26. However, we know that our GP colleagues have had a contract for 2025 and 26 already. So it is a lot of uncertainty for us, but we're not going to sit on our laurels. We're not going to just stand back. We need to be proactive. So if there's any incentive at all, that is one of them. There is obviously general inflation going around. It's in the country, it's global, it's international. This is nothing new for all sorts of reasons, which I'm not going to bore you all about. But we know that we're experiencing increased costs because of that. So that's another reason. Community pharmacies in general, we cannot rely on our NHS income alone. We know that on average, 95% of the income for an average pharmacy will come from the NHS, and some of it, the rest of that will come, 5% will come from other things that we do within the pharmacy, be it OTC sales or services that we offer privately, etc. This is not a balance that is going to work for us. It's not a formula that is going to work for us, because we know that the reimbursement from the NHS, or even earning the income from the NHS services, has proven to be a challenge. Pharmacy fairs being a case in point, or maybe the DMSs, etc., where we're not getting the referrals that we need to be getting. So we're not really hitting the quotas that we're allowed. Community pharmacy as businesses, we just need to adapt. We have to adapt to the changes in the public expectations from us. There was a time when we were stood there and we could actually have extra hands, we could have extra staffing, and we could talk to our patients. We could do a lot of things for free. But now we have to make every minute and every time that we're within our premises count. The reason being, we've got to pay our staff costs. We've also got to pay ourselves, and we've got to make sure that our businesses are viable. So if we need to do anything at all, these are some of the reasons why, and I'm sure you probably have your own reasons as well that you could actually add to this, and I'll be really happy to actually see some of your comments as well. So going back to what Mike Hewitson shared with us, what really stuck with me, and just to let you know that I have his permission to share some of his slides, because I thought that they were really impactful. You don't really need to look any further. We are doing more work, increasingly more work, for a significantly lower amount of money over the past 10 years. So we do feel like hamsters on a wheel. We're just constantly working. We have a fixed price contract, i.e. the global sum that the NHS is going to spend on community pharmacy is not going to change. It means that that same amount of money has to be divvied up in different ways. Yes, we did have an announcement last year sometime about the £645 million that they had given to community pharmacy, something that you've probably heard a lot of ministers and a lot of health secretaries mention and really banded about, that we've had the £645 million money. Have we really seen it? No. 112 million of that money had to be obviously allocated to the fact that we'd spent a lot more money dispensing. And the reason being that we're dispensing even more prescriptions. If you do the maths, you know that that means we're working a lot harder to get the same money. So yes, we've been given some money, but we are working really, really, really hard to try and get that payment for what we're doing. So that's one of the things that really stuck with me from what Mike Hewitson shared with us last 2 weeks. So how do we really sort of deal with this? What I'm hoping to share with you is about thinking about valuing your time and also the services that we provide in community pharmacy. Okay, I'm hoping that by the end of the session, you will be empowered to consider or at least implement a transition from really providing these free services to getting paid for that. And when I mention talk about transitioning from providing, sort of free services and actually getting paid, it's not about everything that you do being paid for by your customer. It's about looking at actually other things that you should stop doing so that you can make time to actually earn money from the time that you spend, sort of within the pharmacy. So the session is going to be looking at that. I'm hoping that by the end of that, you will be equipped as a provider to really think about some of the strategies I'm going to share with you and some of the tools to try and communicate your value and your expertise and your time effectively to the patients. Some of that would involve using your teams, but we'll look at that later. So while we're on that note, I'd like you to really think about just one service that you're providing currently for free that you think you should actually be charging for. I think we've all got something that niggling at the back of our heads or actually really shout at us that we don't want to be doing. So Olivia, is it possible to see if there are any of that in the chat at all?
Yeah, so people are starting to write in the chat, and I will...
Unfortunately, I'm not able to see the chat at the
yeah,
moment.
that's okay. So delivery, dosette box, delivery, blister pack, MDS and delivery, blister pack. I think that's a phone call advice. That's an interesting one.
Yeah.
Delivery of dosette box, care home advice. Free advice in a consulting room.
Yeah.
Ear check for adults, that's pharmacy first. I guess we can address that in a different way. Yeah, walk-in consultation. I think the three most popular, I guess, will be delivery, MDS, and then free advice that you give over the counter or in a consulting room for people who are either not eligible for services or pharmacy first. Yeah, pharmacy first only covers for each ear check. Free advice as my doctor and regular pharmacy are too busy. Informal BP checks coming for ADHD repeats. So people coming in for BP checks that are not qualified under the service. So a few services and mostly delivery and MDS.
Yeah. That doesn't surprise me at all, because from conversations that I've had with quite a number of pharmacists, I think that's probably one of the biggest, sort of issues that we find. These are services that historically we've offered for free. Majority of people have offered that for free for a very long time, and it has become almost like a mainstay of what we do. However, that comes as quite a cost. So basically, I'm hoping that by the time we finish this, you will be able to understand how you can value your time. and why that is really, really essential for us to do. And then we're going to look about how we actually strategize and transition to get paid for some of these services that have already been mentioned. Again, I think it will be really useful, and also something that we can do together is to actually collaborate and think about how we can actually solve this problem, and how we can actually go back in our day-to-day jobs and actually try and implement some of these changes that we will discuss later on. So why is it important to value our time? We've already spoken about the reality, sort of the economic situation in which we are. There are rising operational costs, and there is a real need for us to basically reassess the value of all the services that we provide. When you think about utilities, we think about the staff costs, we think about all these things that are actually adding on to us. When you actually go down to the bottom line, this is not going to change. We're not the only ones. It's happening within pharmacy, it's happening within other sectors as well. So we can't really cry poor us. This is the economic reality in which we're living. So this is an important thing for us to really consider. There is a perception of our expertise that I think is very, very, very low. I think that is low because we are not basically charging for our services, and it's important to actually take ourselves back to what other service providers do. If you consider what other professionals do, giving free services denotes something that is cheap, it's free, and why should that be of any value? They can go somewhere else. And I think it's really important that we actually start to think and change the perception of that expertise that we have as pharmacists. Compare ourselves to other, industry people. We've got the lawyers, we've got the electricians. I gave after the example, you can think of all these other people. They're plumbers, they're nurses, they're dentists. There aren't any other professionals that you can go and get the expertise from without actually putting some money aside, or at least allocating money to that. But for some reason, pharmacy as a sector we have historically accepted an open door policy, which can be very good for us, and can be a strength. But there is a limit to what we can do for free. And I think where things are biting, we now need to actually appreciate that actually we have a value. We rate very, very highly where customer satisfaction is concerned, and we need to actually make sure that we use or utilize that. So we can't keep offering free services, because if we keep offering free services, we can be perceived as being cheap. And if we are perceived as being cheap, I think some of that underpins why we are struggling to even get a contract for 2024-25, let alone 2025-26. So what is the real value of the free service that we offer? I think there's quite a number of them, but the main ones were the MDSs that we do for free, or the doorstep boxes, the deliveries that we send out to patients day in, day out. I think most pharmacies probably have a delivery person or allocate a significant amount of staff time to deliver to patients. We need to start quantifying what that is, because if you don't put a sum to it, what you might find is that you do not actually think about what that is costing to your business. And when you actually start looking at that cost to your business, you will soon realize that actually this is something that we need to be doing at a fee. And I'm just going to give a disclaimer here. There might be some figures and numbers apportioned to certain services. I have to be absolutely clear that this is not about setting a market, pricing at all. So we don't get into trouble for this. It's really just sharing my thinking about what that value is for me, or my thinking about what I've spoken to other people and what the value is. So this, by any means, it may be very far removed from the reality of some people, but it might be close to some people, close to the reality of others. This is pure coincidence, but I've tried to put some numbers just so that I can get people thinking about valuing their time. And a lot of this will depend on how you execute some of these services that you offer. And you may decide that actually, you know what, for me, this is free. If you're able to do that, kudos to you. But I think it's important to put some figures to it, but it's not to say that this is what it should be. It's just really to be able to have something to think about. So I'm hoping that we can do a quick brainstorm again, really. The hidden services that we offer, I just wonder whether or not you can think about how that really, sort of how that affects you and what that means for you. Olivia, I know we had a quick discussion about that.
Let's see whether our delegates this evening can think about the impact that this free advice or non-remunerated activities cause them. So again, if you want to reach for the chat, you can write anything from, increased stress level for my team, anything. There we are. That's stress on you and your team is a good one. What else can people think on the expectations from that the pharmacist is available for the patient, to members of the public? And we've always said, I suppose, as an industry, that we are the only healthcare professional that's available without an appointment. But I often say to patients myself, Patricia, I say, it's not because I am available without an appointment that you don't have to wait. Sometimes people have to understand that they may have to wait in order to get the advice. Okay, the public, I suppose, Nick is putting in the chat, public, from the public expectation of the pharmacist. Yeah, so some people are putting sourcing stock there. Khaled, thank you for that. Sourcing stock is something that I suppose we do for free, especially if we're in a position where we are losing money on dispensing medication.
Indeed. And I think some of the other things that we don't actually quantify, but is really important. Think about that patient who's come to you, that patient that you've actually been able to identify that they are actually at risk of sepsis. Think about that journey that they would have to take to the hospital. Think about the admission. Think about that cost to the NHS if things did not get arrested quickly. And these are all things that actually we've got the expertise to identify. So that conversation with that mother who's come and said, my daughter is in a lot of pain and she actually, she doesn't even want to move. And, she's just lying there. And you're saying that for me is serious. If she's got a wound and she's not moving because she's in so much pain and she's actually that lethargic, you need to call the ambulance, okay? And these are the sorts of things that actually wider commissioners or the NHS may not necessarily put value to or quantify. But imagine the scenario where this person did not go into hospital quickly because they didn't have access to you and your expertise and the knock-on effect of that. There are wider implications of it, but the value that you hold in some cases could not be quantified in terms of money. And that's something that is really important for you to think about. So when you're taking that phone call and having that conversation with the patient or that relative or whoever and giving them that advice, that is time. And some of these conversations can actually take some time. It might involve several symptoms as well or other issues that they might bring along to you. So consider that you have your locum doing this for you. An average locum costing about £35 an hour or so. 10 minutes of that, about £6 of your time or your investment. What could you buy with that? You could source some of your generic drugs, maybe not so much of it now with the prices that keep going up, but you can imagine what I'm trying to talk about. What could you be doing with that time? So let's flip it on the other side. You've not spent that time just talking to somebody for 10, 15 minutes. That pressure that we have because we are so under pressure to get these prescriptions out on time, and we're literally pushing other services to the back burner because we haven't got that time. Imagine that you preserve that 10 minutes of time and you deliver that blood pressure check. That's £15 that you've earned. Imagine the time that you spent or you think you haven't got to actually get that patient booked in for their ABPM. Couple of, sort of 2 sessions of 5-10 minutes, £45 in your coffers. You do 1 ABPM check a day, 5 days a week. I Can you do the simple maths for me? I think I worked that out to a very significant amount of money. I'm just going to share that with you because I worked out that for an average pharmacy, that could actually cover for the year the increase in staff wages and NI increase. So this is what I talk about. You must consider the cost of your time. The time is not just about what you're doing, is what you're not doing because you're under pressure and you're not valuing the time that you're spending for things that you're not being paid for. So it's really important to start to quantify that. And I gave some examples which have already been mentioned. The telephone calls that we pick up, the extended over-the-counter conversations that are unplanned. So you might actually leave your checking bench and then obviously go and speak to someone. And then it turns out that this is actually a little bit more in-depth than it needed to be. And if you were aware of that, you probably wouldn't have actually just committed yourself to that conversation. What do you do after that? You shut your shop, everyone else goes home, and you're there catching up with your check-in, you're there catching up with your admin. So these are really quite costly things for us. The delivery service that we're doing routinely, medication compliances that we're giving, some of these patients they do not actually fit the DDA, but I think somehow because of generosity in the past, we have put them on because it helps to facilitate their lifestyle, but actually it's coming at a cost to us. Sometimes you get people coming in. I run a travel clinic. I don't know if you get this often, Olivia, and they might not necessarily book an appointment, but initially, before I caught on to this, they will come in and ask for a very simple travel advice. And before you know it, you've given them the information they need. And what do? They don't necessarily come back. That is
I totally
a free
agree.
consultation. Yeah.
And that is how people are feeling tonight, you know, advice that you give for free, and that works just as well for the travel clinics. So a point well made.
I mean, I don't know how many of you have had this, but I've had this. They'll bring in their letter from the hospital or their blood results and say, oh, I saw the doctor and they said this, what do you think? You know, should we really be delving into it? It's very difficult not to know what you know. And when they trust you, they will come to you and they will ask you questions. You know, I'm sure we all have examples of people who have said, oh, I wanted to speak to you first before I go to my doctor. I trust you to tell me the right thing. It's great. It might make you feel good that they trust you, but you spent a lot of time actually having a conversation. What you've done is actually shorten a consultation that is being paid for in the GP practice, but you've not gotten paid for it. I just really want us to just start thinking about what this means in terms of all these things that we do, which is great to be able to do, but actually we make someone's work a lot easier and our job a lot harder. So what are some of the paid sessions that we can really sort of consider? If we sort of consider an average locum rate of, you know, sort of, you know, £6 for 10, you know, sort of 10 minutes or so, and then compare, you know, to a contractor as well. So if you're an owner manager, I'm just giving a nominal, you know, sort of rate of about £60 an hour. That's £1 a minute. So every minute that you're standing there doing something else, and therefore that you're not being paid for, that is £1 that you're losing. How many people would just stand there and just keep dropping pound coins and walk away? I don't think we should be doing that. And that's what I want you to be thinking about. What could you be doing instead of all this other free stuff that we're doing or the free conversations that we're having? Could you be doing the blood pressure check instead? Could you be pitting your patient for their ABPM? Even if you're having a long conversation with them because, you know, the results are not great, don't forget we're not the ones who are making diagnosis. We're going to send that over to the GP as well. So it's really about quantifying it. So when we talk about transitioning from the free to paid services, it doesn't only involve actually start to charge for certain things that we do. It's also about freeing up our time so that we can actually deliver some of these other services that the NHS has commissioned us to do. There are a lot of things that you have to consider when it comes from traditional. And of course, you know, if you think about it, you've got to balance a lot of things. There's lots of ideas that we might have. You do need to be motivated. You've got to make some changes. You've got to consider that. But all of these things, if you look at that slide about transition, all of those things somehow will feed into how or what we need to consider to then try and make that change. And the change being that we're going to start getting paid for a lot of the stuff that we do rather than the other way around. So some of the chargeable services that we're looking at, which includes the doorstep boxes and the deliveries, the medicines, sort of use reviews. So I don't know how many of you have considered this, but some of the conversations that you have with your patients, I know that I do, feels like I'm doing an MUR, except I'm doing that for free. So this is a service that the NHS paid for, and then for some reason, they decided that actually it wasn't quite being used enough, or it wasn't quite delivering on the results that they expected, and that was actually stopped. I'm not sure how many of you know, but I still have patients, and certainly in my previous work, patients came in and actually were so used to having their annual medicine review that they still wanted it to go on. They wanted to still talk to you about their medication, except this time we have no funding for it. Is it something that you can consider doing? I would say yes. There's some people who've come in and they've asked for their passport applications to be signed. Have you considered actually that this is something that they pay for in their GP surgery? But they've come to you and you're probably doing it for free. If you do get asked a lot about that, something to consider. I've had, people mention about, coming in with forms to verify their housing application, other, sort of administrative tasks and things like that, which we get asked for because we are, sort of professionals, and they would mention us, our profession, in a lot of these documents as people who can do that. If they went to another setting, for example, their GP surgery, they will have to pay for it. So something to consider. If you're going to be doing this, make sure that you're doing this and getting paid for it as well. So when we've decided that there are things that we're going to actually start charging for, it's really important to start thinking about how you're going to start pricing it. And this is where I have to be very clear that this is just an example of what I think that we, sort of I would consider and have considered. So it's not to say this is what you should do, but when you're going to be pricing, is that particular item eligible for a fixed fee, for example? So I've used deliveries as an example. Some people might choose the option of pay as you go, and I'm sure some of you over here already charge for deliveries as well. And I know that the other model is actually where there's an annual fee for it. That way you can then obviously, sort of deliver to the patient when they request. However, there are pros and cons of either way. Pay as you go or subscription, you need to be careful that you do not fall into that situation where you're getting multiple requests, either in a day or in a week, or an open, sort of almost like an open check in terms of delivery. So do be very tactical about how you decide on doing this. If you're going to give a subscription for the year, are you going to say that we can deliver you twice a month or once a month or whatever? You need to be really, really clear on what you're delivering. And then, of course, be very, very clear on how you're going to obviously take that fee. Other things that you could do, be considering bundle pricing. So can you put a number of things together and then obviously charge a fee for all of that? So consultation and delivery of annual packages. Think about, for example, if you're offering an asthma, for example, clinic check. So there's some patients who will never attend their GPs. They don't attend their GPs. But if you have that specialty, they will come to you and get those those reviews done, and you could send that to their GP. Could you include that with, say, for example, smoking cessation service, for example? So it's really about thinking about how you would do it. You could decide to do an annual one because some things lend themselves more to it. Or you could actually, you could actually decide to actually break it down and just give a fixed fee for whatever you do. But it's another way of pricing. And of course, you can also put incentives, for example, sort of a free initial consultation, and then you charge subsequently. I know that has worked in terms of for my weight management, where I've actually had a fixed fee, which is a little bit higher for their first consultation because that's a longer one. And then what I've thrown in will be subsequent visits where they've not had to pay, and then you do that again another month. So these are ways to actually consider how you would charge for the services that you choose to charge for. Okay. it's really important. Once we've actually decided what services we want to offer and decided how we're going to actually charge for those services, how that is communicated and how the value of those services are communicated to our patients are really, really important. Don't forget you have an expertise, and a lot of pharmacists now, certainly in the community, are independent prescribers. So you have got a specialty in a certain area. If you're running your diabetes, if you've got a specialty in diabetes or menopause, think about how you offer or communicate that as a premium service. Okay. You are going to be giving them something of quality, but you're also going to make sure that you price that appropriately. Highlight to the customer the benefits of you actually booking an appointment and them actually seeing you. It saves them time. It improves their health outcomes as well. And the list is very, very long. I think, a lot of IPs have done, sort of their competencies in different areas, but you can extend that as time goes on. And that's really important to think about. I did want us to do a role play, but I think that will be a little bit hard to do. So, Olivier, if we can just really consider how we can explain why a service now has a fee. In what we're doing. I will have that on other slides, but it's really about a patient coming to you and your staff trying to communicate to them why they have to pay for something, or actually, if you're going to book an appointment for them to see your pharmacist who is a specialist in a particular area, why that would come at a fee. We have to include a transparency about the rising cost and the professional investment. You didn't become an IP through sort of someone's goodwill. You paid for your training. You also took time out, and your time is money, to actually get yourself trained to become an IP. You have invested in equipment. You have invested in time to actually set up your clinics, and you need to make sure that that is understood. So whatever they're getting from you is not substandard to any other clinician sitting in another setting. You are just doing that in the community pharmacy, and you're offering them convenience. So it's important that when you're talking about a fee, the way that that is promoted to your patients or your customers must include the fact that there's a convenience, but also there's an expertise that you come with. That is why you're offering that service.
Patricia, I just want to point out, someone put in the chat in case other people haven't seen it.
Yes.
The charge out rate of a private GP, with regards to what does a 15 to 20 minute consultation cost with a private GP, and maybe an extended consultation of 30 minutes or more. And it's interesting to think that people are paying for that service whilst they could probably still access their local GP for nothing. So in that same way, I think pharmacy needs to think about how they value their time in exactly the same way as some GPs who've set up private clinic have done. So
indeed.
I would ask people who are not in the chat to just go and scroll up a little bit. There was an interesting message by Bola Sutubo that gives some idea of prices, and it's interesting to read.
Yes. Yes, and this is really important. And I'm going to come again to looking at what's going on in the market around you and what's going on in general in the market. I think community pharmacy in general, unless you've been that inclined for a long time and you've gotten comfortable with that, it's very easy to actually undersell what we do. And it's going to need a mindset change, that first of all, we've got to charge for what we're experts in, and also to charge it to our customers. Don't forget, it's not everybody who's going to subscribe to your services that actually brings their prescriptions to you every day. They've come to you because they want the service that you're offering. So you might think that as a goodwill, I might do something for my regular customers because that's my regular customer. But you've got to be really, really careful that the message that we send, if we're not actually valuing that time that we're giving our expertise to the patients or the customers, then we are always going to be where we are. but looking at what others charge, and your patients will be quite happy. And I think I've had this conversation with some colleagues before. They've paid for the private, consultation, £120 or whatever, and then they've come in with a prescription, and they are not happy to pay £20. They're not, and and that £20 is you trying to value your time spent checking that prescription that you've put a dispenser through. They've gone and retrieved the code. They've printed it out for you to be able to do, and then they don't want to pay because, oh, is it £20? Yes, it is £20. But they've just paid quite a lot of money to be seen. So it's all about the value that we've put on ourselves. And this is where it's really important that we need to start thinking. I have the benefit of actually having a nurse background, and I have dealt with a lot of nurses who've offered private services. And there is no hesitation to put a value to the fact that they are providing a private service. It seems to be something within the remit of community pharmacy where we shy away from valuing our time and actually putting an appropriate price on what we do. And some of it may be because actually we are in a market that can be very competitive. And I hope I'll be excused to say that sometimes that's very, very short-sighted, because until we actually consider what we are really worth, we're always going to be undervalued. And when you're not valued, you are not going to get anywhere, especially in this climate that we're in. So explaining why the service is now not free is really, really important. But also, it's important to actually be quite transparent about how you come up with your costs, and the fact, and how you've come about offering that service, and also the fact that there are rising costs. And there's nobody who at the moment doesn't understand if they have to pay bills. Understands that the costs are rising. And it's interesting, actually, in my day-to-day experience, I do have patients actually saying, oh, things are so hard, and they've heard a lot about what's going on and what the MP has been doing, and they completely understand that we are in a difficult position, and we've got to stick up for ourselves. So I think, sort of the climate is such that patients do understand that we have to charge for our time. Of course, there is something about overcoming customer resistance as well. And the ways that we can do this is think about being very transparent with what you're doing, but also acknowledge, that, so people do have financial concerns, but you need to emphasize the fact that there is a mutual benefit. There's a benefit that you dedicate good time for them to give them good care, but also they then get, obviously, the best out of the consultation that you have with them. Implement your changes gradually. You might want to introduce a fee for a service that you've chosen to deliver one at a time. So I don't recommend that you go in and start charging everything. I mean, I do know that there's some people who have done that, but you might want to look at how that would work for your particular business. So it's about doing what will work for you. But I think the general rule will be, if you introduce a service one at a time, first of all, you ingrain into your day-to-day work. Your staff get familiar with it, you get familiar with it, and then you throw in the next one. Of course, it's important to educate your patients, and this is pretty straightforward stuff that you do all the time anyway. And there are different ways of doing it, be it using posters or the digital screens that you already have within your pharmacies. So it's really a good, sort of point to actually then consider, why are you going to charge for, for this now, for example, is a question that you could be asked. And I don't know if, Olivia, you had a chance to consider that question. Or if anyone wants to type in what they would say or how they would approach that question, why are you charging for this now?
So I'm going to just give a little example. Customer resistance, and I see a lot of comments in the chat about this needs to be a collective action because the pharmacy down the road will do it. I'm just going to give you an example of something that happened to me today. I got it's not really a care home, but a place with 8 residents looking to have a pharmacy doing 8 blister packs for their patient on a monthly basis because their local pharmacy refused to do it. I said, well, I can do it, but my cost is £20 per patient per 4 weeks. They have gone to think about it, because once I've explained to them that our funding doesn't cover the cost of consumable, and we have to have a technician to dispense these prescriptions in blister packs, and it takes a lot longer. You know, you then start realizing that we probably don't need to all do it. If we just stuck to our gun, you might not gain the business, but why would you want to gain business for which you lose money? So the point is, how far do you go? And I think if you explain it and the rationale behind why you've decided to introduce a charge, you're not going to please everybody, but why would you continue doing something for which you're losing money? I mean, the cost of dispensing and consumable is outrageous. So that's an example, and perhaps people can put in the chat a bit more. Let me just go back to the chat, Patricia.
Yeah.
Yeah, so local commissioners ask for urgent delivery. There is no such thing as an urgent delivery, and obviously the delivery is a big part. Similarly to the MDS, how can you introduce a charge? Well, I had a patient the other day who wanted me to deliver, and she lives 15 minutes away, so it's half an hour to deliver an item, and she's on mental health medication, and she has the prescription every 2 weeks. And I said, I'm going to charge you £6 because it's going to take half an hour for my driver, who's paid £12 an hour, just to get to you. I'll cover the cost of the petrol, but I'm going to charge you. And she said, well, I can't afford it. And my response to her was, well, you can change pharmacy, or actually even better, if you want to continue using us, and you've got mental health and you feel a bit agoraphobic, why don't you go out, come and collect your prescription? It might be a 20 or 30-minute walk, but actually he'll get you out of the house, and he'll do the best for your mental health. It's a hard conversation to have. That patient has not gone elsewhere. She's coming to collect a prescription. I'm not delivering it, and she comes every 2 weeks. So you've got to be when I read people saying, oh, the NPA must do collective action, there may be a time where the NPA recommend action, but I wouldn't be too frightened about the pharmacy down the road doing it for free, because they'll only doing for free for a very short time, and then they'll realize that actually you're the winners and they become the losers.
Oliver?
Yep.
Could I just come in? It's something I've known about for a while, but there was a really good article in Telegraph this week, in fact. There is a provision from the government of the attendance allowance. I'm not too sure if the 112 pharmacists on this, or 107 on this webinar are aware of it, but it's around about £80 a week. Yeah.
Uh-huh.
And that money is specifically for the applicant to use for care needs. It's there, it's available, it's not means tested, and it can be applied for. And I think, when you start to consider that, there is no reason to charge for anything. We need to try and get people to, if they need this help,
Correct,
to apply for the attendance allowance.
Correct.
Have you heard of that before?
I haven't, but we'll certainly look into it. I personally haven't. There might be other people. You're Mark, aren't you?
Yeah.
Oliver,
Yeah.
I've heard of it. It's not that easy for them to navigate, and I don't think we need to spend our time navigating that.
So let me take this offline, and then we'll get back to you on this as to whether that's an option.
Okay.
Thank you.
Thank you for that. Any other comments at all about how you would tackle why are you charging for this now?
I think a lot of people are putting suggestions about other people, such as, doctors need to stop telling patients to have their medication delivered or done in MDS. That communication with the surgery perhaps is a good one that would help, to address this. The surgeries equally wouldn't do anything for free, and we all know that. So when they say, well, the carer tells me that the patient needs it in an MDS, I say it's all well and good, but the doctor's not paying for it. So, having that conversation with the GP in the first place might avoid this difficult conversation.
Indeed.
Can I come in again, Oliver? My experience about this attendance allowance as well was we told a care home that we were not going to supply dosettes for free anymore. And I gave an amount, I worked it out about £4.50 per week per patient. And within probably less than 10 seconds, he said, yeah, sure, no problem. We'll just take it out of the attendance allowance. So even people in care home are given a non-means tested care allowance called the attendance allowance for use and it's ring fenced. It's not to be taken off them for use in the care home. It's their money. It's separate to the pension and other assets. And it's use for things like soap, shampoo, care needs, birthday cards, small gifts to family.
Mark, I said we would look into it. I thought I don't
I just
think that's
wanted
a
to just to
conversation for
reinforce
this
it.
evening, but we have registered the point, and I'm going to let Patricia go on. But that's a very valid point, and I think we'll take it offline in order for this evening to continue. But that's a point very well made.
That's good to know that, Mark. So some of the tools and techniques for implementation. So once we've decided what we're going to do, we've decided we're going to charge for it. We've decided how we're going to communicate with the patients. Now we need to find tools that will actually make this easy for us to actually execute. Using your technology, if you have your EPOS systems and you've got your prices preset in there for services, it's very easy for staff to just press a button and that gives them a fee. They don't have to try and remember how much one service or the other costs. What I've done is I've actually basically put them under different icons and different buttons. So there's wellness services, and then there's a travel service, and then there's a private. It means that it's very easy for your member of staff to go into the right service and then just put that in. There is no hesitation then because the till says it's £20, the till says it's £10 or whatever. So really important to think about how you would make those charges or the fees that you've decided to charge easy to take from your patients or customers. If you're that inclined, you can use online booking platforms. I know several people who use these ones. There's Bookly, there is, sort of patient access. I think you can actually take fees from there. I'm not sure if they still do. Jelly Software, there's Stripe, there are a number of different solutions to actually taking bookings online and also taking payments. So I don't actually use any of the online platforms to actually take fees, but that facility I know people use and it's available to use. So it is worth considering doing that. Consider obviously the marketing strategies that you're going to use. Position your offerings as an enhanced, care package. If it is an enhanced care package, it means they're getting everything. They're giving a special care, they're giving a special treatment. So make sure that you're positioning that very well. You can introduce loyalty programs as well. Make sure that it's easy for them to know that actually because you're getting this service, you're going to get that service cheaper. And that is really, really useful way of incentivizing your patients. Think about what you're actually doing. What are the services that you're delivering? What are the changes that you're making? How is that affecting your customers? Are you retaining your customers? What kind of feedback are you getting? Ask for the feedback. Very simple. Once they've actually had the service, you can give them a leaflet or have the QR code for them to scan. One of the things that we did when we engaged the COVID vaccination was to use the QR code, and the amount of reviews that we had just by having the QR code handy for them to scan when they came into the consultation room. And now that is used for other things. So it's really, really important to get your customer feedback. You must quantify these things. If you're not quantifying it, then it's difficult for you to know whether or not it's actually taking off, but also is it worth spending your time doing? So really, really important to get their feedback, but also to check your growth in terms of revenue from the services that you're offering. These things, if you've got them on your tills, then it's easier to pull off a report and to be able to see it. So that's why it's important to consider using your tills and your EPOS systems to actually put prices on you for the services that you're delivering. The other thing to do is that think about, now that we've actually gone through what the services are that we want to obviously offer to the patients, and we've decided how we're going to get feedback about it, I think is really, really important that we try and consider within this conversation, within the space of other colleagues, how we can try and create some sort of a service, a premium service. And then, of course, think about the pricing of it and then how we will communicate that plan. I did want this, if this was a face-to-face, then we would really have a breakout room or something and try and do this together. But we're going to have to do this online and together. But I thought that it would be a really good thing as part of this session, and to really get you thinking about taking this forward, is to actually start thinking about implementing some of the tools and techniques that we've spoken about. So is there anything that we can can that be put in the chat as well?
Yes, sorry, I'm coming off mute. I was responding to another question there, but yeah, we could. I'm not sure the pricing. I mean, pricing obviously will depend on the business, and some people may have higher rent and, you know, more affluent area. But in terms of designing a package, I think this is something that perhaps people, you know, could make a note of it and go away and think about what is right for their business, because they may not decide, you know, people may not decide to charge for everything. You know, you might say, well, I'm going to charge for delivery, but the administration of that is difficult, so I'm going to concentrate on something that's perhaps easier initially. Obviously MDS pack is a big one. But the advice that you give to travelers on private services also probably is payable for. So is, what do people think they can do? You know, I've already said I charge £20 for an MDS pack, and some people might decide that that's too much or not enough. You know, the communication plan is important. Equally, you know, perhaps Patricia, you can tell us what you charge for a travel consultation.
The way I run my travel clinic is anyone who comes in and wants travel advice, if they phone through, they will be requested to fill in a travel risk assessment form. And that would be the first thing they have to do before I have any conversation with them. They can either come in and pick up the form, fill it in and leave it with us, or they can request an email copy which they complete and send it through. But they must pay for it before I have the conversation. This is because I've learned from experience, once you've had that conversation with them, you may actually lose them and you've done the work. So I do not actually give any travel consultation or travel advice until I have a risk assessment form. The staff are coached now. They know that when the form comes in, they take a fee. I do get them to give consent for their summary care records as well. It means that I've got access to any of the relevant information that I need from a clinical point of view, so that that next interaction I have with them, if it's not face-to-face at the appointment that they come for, then it's actually over the phone, and we then agree what they need to have before they come in to have their vaccination. That way I'm not losing on that consultation fee, and that's really an important lesson that I learned over time. After that, of course, doorstep boxes are one of those. I inherited quite a lot when I first went into the pharmacy. I've worked my way out of that. I'm not quite halfway through, but I do have a system in place now that those who want this for their lifestyle, they will pay a £20 fee. And some patients do, their family would pay for it. Or any new patient, although I'm not necessarily taking on new ones, if any new patients are taken on because they need that, then they understand that there is a fee attached to it if it's for convenience rather than because there's a disability, for example. So I do charge for those services. I don't charge for the deliveries, and I have minimized my deliveries because I do not feel that I have the time and the capacity to actually implement collecting that money. If that helps to give context.
Thank you. Yeah.
What I've done is I've just created a few things that we can actually just go through, something that you can give to your staff or train your staff or give them some background so that they can use their own wording, but it just gives a little bit of background to how you can communicate some of these services to patients. So, oh goodness me, I've just gone back to that. That's good. So medication reviews, for example, we now offer detailed medication reviews as a premium service for, £30 for a 30-minute appointment. This ensures comprehensive care is tailored to your, tailored to your treatment plan. So basically, you're letting them know that they are going to get charged for a medication review. That comes at a cost, but they're going to give a certain amount of time to them, and you're going to make sure that it's one that is going to be worth their while. Does that make sense? So you're communicating to them that there is a fee, and that fee is for a certain amount of time. So we are really, really clear and transparent in terms of what we're going to be doing for them. Deliveries, again, to maintain reliable delivery services, we've introduced a small fee of £2.50 per delivery. It makes sure that you get your delivery on time, or at least we can sustainably offer that service. Private consultations, for example, because I have had quite a lot of time where people have asked for a private consultation and you don't quite know what they want to talk about. So I have actually put a fee to that. For the travel is £20, but I have put a fee for £30 for any minor illnesses. So before they get into the room with me, they know that there is a fee that they will pay, and they will pay for the cost of any medication that they have from me as well. Our private consultations now include that fee. It ensures that you've got a dedicated time to address your health concerns. That is a way that the staff can use the wording whichever way suits them, but at least it communicates to the patient that because we're going to make specific time for you, this will secure you that time with the pharmacist, and then you can speak to the pharmacist about what is your concern, and you'll get looked after properly. So it's really about telling the customer what that fee that you're charging them is going to do for them, but tell them what the fee is as well. The same thing with the travel, sort of services as well. It ensures that you get expert advice. So I do that, and the patients now know that they have to. And I think sometimes the word spreads as well. So the numbers have gone up, but that's because they know, and you're now doing the service a little bit more frequently. Before, where the staff didn't understand what they had to do, and I'm going to come to that now about staff training, is really important that they're very clear on exactly what services that you offer and how you actually deliver those services and how they book appointments. Because if they can communicate that to the patient, then you can find your numbers actually grow as well. I'm not going to go through all those scripts, but you'll have that on the slide. But it's just really examples of how you can communicate different services that you offer to the patients as well. The point of care testing, for example, depending on what you're doing and what equipment you're using, that might come at a fee. I actually have a phlebotomy clinic that I run, so I do communicate to them the fee, and we've got in the diary exactly what the price list is. So when the patients ask for a particular blood test, they get told exactly how much it's going to cost. And of course, depending on who you're using, I use LML, there's now a fee actually for using a courier or for posting it. So it's important to communicate that and make sure that that price is very, very clear, what they're paying for in terms of the blood test and what they're paying for in terms of actually getting that test sent out for them. Again, these prices are put on there are not to lead people. It's just really to give you something to think about. So what is the rationale really for charging for the services? The services require expertise. They require a certain amount of time. There are resources that you will have to have available to be able to do it. And customers really appreciate that they are being given something that is of a premium, sort of service, rather than just walking in and just have a 1 minute or 2 minute conversation with you, and then they feel like they haven't got, sort of everything out of that consultation with you. So it's important to let them know that you're charging for this because you have expertise and you're going to spend your time and you're going to use certain resources depending on what you're doing. For example, if you're doing private stop smoking, you would have to have a CO monitor, etc. So it's important to let them know. Implementing charges also ensures that you're actually able to operate and carry on doing what you're doing in that setting. We're not going to carry on doing what we're doing for free and expect that this is going to be sustainable unless the NHS comes up with some magic, and they haven't done so far. It's really just important for us to be thinking about just moving away. And I think even if we have an announcement that involves an uplift, I doubt that in these times we're going to have such a significant uplift that we can actually just sit on our hands and do what we've always done. It's just not sustainable. So the checklist that you're going to have to do, identify the free services that obviously involve a lot of your time and involve a lot of resource, which is costly for you. Decide on a pricing structure. Think about what's going on around you, and think about, sort of giving some sort of incentives to start your patients or customers off, and then carry on with that. Think about how you communicate this to your customers. Make sure that your staff understand what to communicate to the patients. Give your staff the adequate training. We've talked about freeing up your time to deliver services. You can use your support staff to deliver things like your blood pressure checks. Use them, train them. The training is pretty straightforward. I am happy to share this type of training that I've got with my staff, but I think this is something that we can all, identify and do. You've got to train them, make sure that they understand what they do. I paid for 2 other members of staff, including myself, to become phlebotomists because I wanted to have the whole week covered, and that is really, really useful. So think about how you invest in your staff training, because that's really going to be how we free up ourselves for other things as well. Updates any signage that you have or any leaflets that you have, and your website as well about services that you offer. Keep that going, because if you're offering the services, part of it is also about marketing it. I'm not going to try and tell you about that, but you know what to do anyway about that. But it's just a reminder that you do need to put it out there that you're offering those services. And I think it's really, really important to be open that some of the things that you might do may work, may not work. Just start with one service at a time. Make sure that you're actually reviewing what you're doing and get the feedback for the services as well. Really, really important. I started with weight management several years ago, soon after lockdown. I became slightly, how would I call it, disillusioned when my patients did not really commit very well. But don't forget, this was COVID times that we just come out of, and I think it was really quite a challenging time for people and for myself. I have relaunched that, and that's now taken off on its own. So it's really important to be prepared to look at what you've done before and be prepared to adapt and change it. Make sure that you are monitoring your revenue from these services, and also try and introduce other services to your repertoire, because that makes your time pay. The only thing that I would really suggest is that try and commit to some kind of action that you're going to take. MPA has been really, really good. Paul Rees, obviously, he's no longer with us, but we really have had such great support from the MPA to really try and get it out there, what pharmacy needs. But we cannot just be reactive. We need to get out there and do something for ourselves. The MPA has a lot of stuff on its website for members to be able to actually train staff, to be able to actually set up clinics. Use it, but commit to doing something. So what I would like to see is if you can actually just state one service that you're going to start charging for in the next month. And if you're happy to, please share.
Thank you, Patricia. Thank you. And I have to say, I do charge for some services, but it still gives me food for thought when I hear other people now, like you, who deliver services. Now, I just would like to cover a few things that and people are putting in the chat that they're going to start charging for MDS and delivery, which is really the two that most people are considering. But I've sort of made note of some of the questions that have come down. And by the way, this webinar is being recorded, so you will be able to see it. And if there is anything in there that we haven't answered, we will certainly address it and get back to you about it. But if I can ask you, Patricia, perhaps so that those who are thinking of introducing services can perhaps think about how do they evaluate the service. So, you know, you're going to decide you're going to charge for an MDS or delivery, and then, you know, you want to see whether that's working or not. How would you, in your pharmacy, evaluate how this is working, Patricia?
So one of the things that I've actually done is to make sure that the services that I offer are on the tills. So when the patient comes in and they're having a service, it's no longer just dumped as any miscellaneous. It actually has been allocated, be it a flu vaccination or be it a travel consultation fee. That is actually separate from the travel vaccination fee as well. So what I have been able to do is to basically pull off a report to be able to see in my takings what these services come up to. And it's really, really interesting to see the pattern. What is also done in terms of evaluation, and that was something that I wasn't very good at doing, was to actually start looking at the number of transactions, but not just the number of transactions, but the average item value. And I can see that as the time has gone on and I'm doing more private services, my average item value has increased. And that is quite significant because that's one of the ways that you can actually assess what you're doing, because a lot of these things, for example, your weight management, are higher value. Your travel vaccinations are higher value. Yeah. We do sell a lot of stuff over the counter because I happen to have that type of environment, but that is not a coincidence that over the last couple of years, that has significantly increased. So it's definitely something to do with those services, and that's why it's important to track them. It's, you know, initially, you can probably see 1 or 2 services, and then you find that actually you're doing about 70 of them, and then you know that actually this is becoming, and it's increasing, and the average item value is increasing. Yes, of course, you can argue that, you know, prices have gone up, but that cannot account for that level of increase in average item value. So there are a number of parameters that you can actually look at in terms of, you can either look at the services themselves and how much money you take for them, but you can also even look at the pattern of your average item value, and that will tell you quite a bit.
Yeah, thank you for that. Another question that I have, which probably hasn't been asked in the chat, but it's a sentiment that I have picked up by looking at the comments whilst you were presenting. And it's, how do you transition from a free service to a paid service when people fear, contractors out there fear that other businesses, like large businesses, who might be able to swallow the cost of doing it for free, and whether in your experience where you are, this has happened. I have got my personal opinion, but I just wondered whether, as our head speaker tonight, you might want to share some of your personal experience.
Yeah, do you know, it's been a period, a transition of learning about myself, learning about the business, but also learning about people. It is a challenge because pharmacy is very, very competitive, but you've got to have trust that actually the people around you who are in the same sort of situation as you, and if we network, and in pharmacy, we are so used to working in silos. That is why it's so important to have these sort of sessions that the MPA has, because we can actually speak on an open forum. Transitioning, I did have a lot of concerns. My initial concerns were about you know, charging for the blister packs. I then had to stand back and just look at what I was doing. I couldn't continue to pay the staff costs and just keep swallowing the amount of time that was spent preparing blister packs. So my transition was slow. I started with saying no to new ones. I then started with putting the word out that actually it's not sustainable for me to do this because this is coming at a cost, so that the surgeons local to me understand that there is an issue with just anybody being said they can have a blister pack. When it came to things like the delivery service, I had to consider a weaning off process. So I did that in the way that I felt comfortable with. I couldn't just stop delivering, and I couldn't just start charging overnight for deliveries. So I decided that I was going to go from not delivering 5 days a week, several times a day sometimes, to actually 3 times a week. And then I went down to a couple of times a week, and then once a week. I've now got to the situation where my patients do understand that actually give us a call if you have any difficulties in delivery. And I've maintained on my records, those patients have historically been, sort of delivery patients, but I've had a conversation. I've done it not through letters, I've done it through telephone conversations with them because I felt that that was a little bit more personable. So the conversation goes like this: we are not able to deliver every day as we used to. However, we will try and help you to be able to get your medication. First of all, do you have a friend, a relative, a neighbor, or somebody who can pick up your medication for you? And a lot of people, it's really, really interesting how many people did have another option. The rare occasion where I've had somebody disgruntled, I've had one, and it really broke my heart because that one person went and gave a review on the website and said, I've always had deliveries from you and you're only thinking about money and you've stopped delivering to me, and I've just contacted X number of pharmacies to you who are offering free delivery services. Now, I've had a conversation with X amount of pharmacists who I know are having the same conversations with me about not delivering. So I think sometimes the patients who come back at you with information, yes, they might deliver, but they're not doing it all for everybody, just whenever you ask. They are also having to ask you to think about it. So the patients might even try and bang your heads together, but it's actually explaining to them that actually historically this is not something that we're paid for. We've done it, but times are hard as it is for you, and that's why we're not able to do this all the time. We will try and help you when we can, but we would like you to look for another solution. Another thing that I did was to actually use the NHS volunteer service. And actually, the Good Sam app has been great because they're really promoting it. I have had a conversation with the guy who took over managing that service for the NHS, and he was really trying to encourage me to use that service. So what we do is that we make contact with the Good Sam and we actually book, and somebody comes and picks up for those patients who don't have any other options. So these are two things that I've done. I've done mine in a staged way. Some people I know have actually just written letters and they have stopped it and it's worked for them. So I think you've got to find what works for you. And because I understood that locally, it wasn't the general thing that was done, I had to find a way of transitioning to the stage in which I am. And the good news, and I would like to really share this with you, I had a delivery driver who was working a good 20 plus hours a week delivering, and to some patients really quite far out, and got stuck in traffic coming back and all sorts of things. Now they're a trained medicine counter assistant, they're a trained vaccinator, and they're also a trained phlebotomist. So majority of their time they're deployed doing this stuff rather than driving around to patients who actually sometimes will have a car and people sitting in the living room and they would not come out and pick up because it was convenient for them. So I think, sort of, we're all very kind people. I think by the nature of being in healthcare, we always want to be very, very kind. But actually, we do need to sometimes use our head in some of the things that we're doing. Maybe I'm saying that because I do have somebody who who works in accounts and finance, and he says you've got to take the heart out of this and use your head to do some of these things properly. You do it kindly, but you've got to make sure that you make it work for you. And I think this is where we're transitioning. We really have to now start talking a different language. And that language is about making what we do, which is so valuable, sustainable for these patients that we want to keep looking after. We can't sustain it if we're not changing the way that we behave.
Good. Thank you. I'm just going to answer before I ask you another question. There's been a couple of questions about NPA issuing support material. The NPA is on that, and I'm sure that we will be able to support that, especially if action is called regarding stopping free services. So watch the space for that in your NPA login. That's definitely something that the NPA can do. I have had a question which I promised I would ask at the end, and it is what happens when you have someone who cannot afford to pay for your service?
Right. At the moment, I haven't had someone say that they can't afford to pay necessarily. I have a little bit of a rule that I've done with my travel clinic, and some people might chastise me for this. I have a lot of young travelers in my neighborhood, and I happen to have young sons as well. So I do have some sort of affiliation, or I feel a certain sort of nurturing for these young ones. So when I have the young people who are traveling to these exotic places, I have had a rule where I asked them when I've had the consultation to ask to speak to myself, because I can implement some discounts for them. And some of the ways that I've done this is, for example, if they pay for all their 3 vaccinations, for example, for their rabies, or pay for the 2 Japanese encephalitis, I apply a certain amount of discount, and that often helps them. I've also offered people the pay-as-you-go option, and depending on the individual conversation, and I must say I tailor this to the patient. I then have a conversation with them on how I can support them to be able to pay for their vaccination over the period of time. So in as much as they will pay, they might get a reduced rate for it. I haven't had anyone say, no, I can't afford it, and therefore I'm not having it at all, because I think when people want it, they will have it. And sometimes, you know this with your travel clinic, there are some vaccinations that actually they want, but I help them actually pick the ones that they really must have. So, you know, these are individual decisions. And I think sometimes we've got to just think about how we communicate with them. So for us, you do it with empathy, you do it with understanding of their circumstances. You find that you have a rapport, and you can actually really help them get the best out of that, you know, sort of interaction that you're having with them, and also makes your time pay.
Thank you. This leads on to another question which was asked earlier, and it's about mindset change. And the question wasn't really asked, but I'm going to phrase it on behalf of the listeners this evening. Who needs to change their mindset? Is it the patient? Is it the commissioners or the GPs? Is it the pharmacies or the pharmacy owner? Is it the pharmacist himself? Can you give me an idea of who needs to change their mindset for this to be applied?
All of them.
All of them. Okay.
All of them. And the reason why I say that all of them is because everyone, we are not on our own in this. But I think if we don't value our time and we don't value what we do, nobody else is going to do it for us.
Good. And I must say, I agree with that wholeheartedly. And it comes in with good communication, especially with your GPs, so that you don't end up having the conversation in the first place. I've had a couple of questions about renting a consulting room from your pharmacy to raise some money. Is this something that, in your opinion, community pharmacists should decide? Obviously, we keep saying, or I keep saying, you know, you've got to do what's right for your business and your community. But is this something that you've done or that you would recommend people do? And how would you go about it?
I haven't done it, but I've definitely considered it. I only have 2 consultation rooms, but I did consider within my shop floor looking at actually carving out some shop floor space to actually create, because I do have that space to actually create a couple other consultation rooms. And I have spoken to several people who've done that actually, where they're having maybe a chiropodist or a beautician or somebody else coming within their space. And I think that is really useful. So for us, you've got the right type of agreement. The reason being that actually bringing a different type of clientele into your pharmacy is useful, because then that's increased footfall, and increased footfall is always good if you've got the right sort of things to present to them. If you think about us, sort of having extra consultation rooms now, and I think most people now value the fact that having a second consultation room so that you can do other things, more than one thing at a time, or using your staff to do other things while you're doing something else, is really, really useful. That has been really handy for me, certainly being able to run the COVID clinic in that space. And using my team to do that, and also to run a travel clinic. So I no longer worry now, because I have an ACT who's actually trained to do the BP checks, and the rest of the staff are following suits now. It's basically, they can be in one room, I can be in the other room, and I don't need to worry about juggling that space. So definitely, if you can use your consultation rooms for other things, and if that involves bringing in other providers, that can only be a good thing for you, so far as they're not duplicating what you're doing yourself. So,
thank you. We've had a couple of questions, Patricia, about people who have pharmacies in deprived area where the disposable income might not be as high as more affluent area in and around London. What would you say to these pharmacists when they are faced with perhaps a patient who are pushing back on the fact that they might not be able to afford for a £2.50 delivery or a £20 blister pack? What advice would you give to this patient, to these pharmacists? Sorry.
So depending on the area you are, I'm in a neighborhood which is cross-border, and it might be looked, it's not necessarily affluent, but it does have people who can afford certain things. But I know, having been in other areas, that this particular neighborhood is not the most affluent. So it's all about, it's all relative. However, if you're in a deprived area, it depends on what conversations you have with your patients or what you see. So I was in an area at one point where it was deemed as being deprived, but within those areas, I could see people who were certainly sitting there. They would go to the cafe every single day and be able to buy breakfast, lunch, etc. So it's all about perception. Maybe we shouldn't decide that for them, but if you think about what £2.50 is for a delivery, maybe consider that they come in and pick it up, or they get somebody to pick it up for them, or even consider that actually there is a way of paying for it annually as well. There's a subscription. Could you do that? And they pay for other things. And I think we just really have to be very careful that we're not seen as those people who could always pick up the tab for others.
I heard an interesting statistic, Patricia, and you were talking about weight loss earlier, and we all know that weight loss medication are a hot topic at the moment and cost quite a lot of money. A statistic that 30% of people who are buying weight loss come from the two most deprived area in the country. So these are the people with the lowest disposable income that still manage to find £100 to £200 to access those weight loss medications. So as you say, there's always going to be options, and obviously people have to decide how they spend their money. But I take the point of those who have raised the point that some people will genuinely struggle to pay.
Yes.
And that's going to have to be a business decision at a local level, I guess, for that.
And just to add, it's not a bad thing if you identify there's some patients that actually you need to do this for. We're not soulless people. If you are able to reduce your deliveries from every day to a few times, a couple of times a week, that's still a saving. And that's still time that you can redeploy if you have a delivery driver doing that. So I think, we can start small and build up. You can't, sort of always do everything at once. But if you can change that mindset and start considering what you can do with that time. And remember, it's not all about charging for certain services. It's about freeing up your time so that you can do certain things. And sort of going back to the areas that are deprived. So you might not be able to offer all those private services that come at a high cost. Although, Olivia, you've just pointed out this information that has come out that in the 2 most deprived areas, that's where most of the weight loss medication is being bought or sold. So actually, there is that point. But actually, if you can free up your time and deliver some of these NMS, these NHS services like the NMS to capacity, your pharmacy first, etc., then you are still getting income. It's still transitioning from free to fee. You're just getting your fee from the NHS, which you should.
Good, and thank you for that. There is a question that's just popped in before I go on to my next question. And I promised you we would finish on time. We are way ahead of time, and I really value the engagement of people this evening and the number of comments that we're getting. I'm trying to stay on top of it, and it sometimes goes quite quick. However, someone has said, can you share what type of arrangements you have with other healthcare professionals to provide services in pharmacy? Some have approached this person, but they want to use their own business name within your pharmacy. So, maybe I'll take this one for you. At the NPA, if you are going to rent a room to another healthcare professional, say a chiropodist or acupuncturist, for example, and they want to run it under their own business, that you are effectively not allowed to take payment on their behalf because your insurance won't cover it. That's something that I would say to you because I've come across this. And therefore, the only thing that you can have is perhaps added sales from that person recommended to buy something in your shop, like a Lamisil cream or something like this. But you're more talking about, at that stage, renting the space to them rather than paying them for them to deliver your services. That's very important that you understand that. And I guess that's an arrangement that you need to do. I would probably engage a solicitor or someone to try and draft an agreement so you have something that works for you. And if you think it's not going to work for you, because as Patricia said, you can get a good return by providing the services yourself or using a second consultant room to your benefit, then keep it. Because it may be difficult to get rid of someone a few months or years down the line. So we'll leave it at that. But there are perhaps taking legal advice, but be mindful that you're renting the space and not propping up someone else's business within your EPO still. I just wanted to touch on customer feedback. You were talking about customer feedback and Google reviews and things like this. Can you tell us how within your business you managed that? You were saying that you had a QR code and lots of people were leaving reviews. How did that work and what did that do for your business, I guess?
Yeah, so I did it a number of ways. So the first way of doing it, I just basically created a leaflet. Initially, the first time I thought of doing this, I created a leaflet which had all the sort of the services that we offer within the pharmacy, and then handed that out with a QR code. And patients would just click on that link and then they could just go straight onto the NHS reviews and give a review that way. I've also used on ProScript, there is a facility to actually send texts and emails. So what I've done is created templates as well. So if somebody has a service, for example, and most recently, I just had someone come in and have a blood pressure check. They were just so happy that their GP had sent them and they were very, quickly seen and had their blood pressure check. They were so thankful. I was, what, if you're so happy, go and give us a review. And they consented to me just sending them the link. So I have those links on there. I tend to do, the links are headed for either a new patient or headed for somebody who's had a particular service, and you just say, we would appreciate your review, please click on this link, and then they can do that. So there are ways to make it easy for them depending on how you communicate with them already. But if you don't have them on your database, just give them a flyer.
I've just seen in the chat, a couple of people have suggested to send a Google link to patient after a service, or using AccuRx or anything like this. So some people are already clearly doing that. one thing I would say about Google review is you need to own your Google pharmacy on Google, so you can respond to those reviews and perhaps add some photos and things like this, because that will help people to find you, especially for other services. And if someone leaves a good review, you must acknowledge it. But more importantly, if someone leaves a bad review because they've had to pay for a service and they feel aggrieved about it, you must reply and perhaps make the public aware as to why you've taken that decision. But always welcome the feedback, and my advice is always respond to the feedback.
Yes, always respond, yeah.
And
you
respond
can
personally.
have, you know, within my team, I have a member of staff who likes to do that. So they take on the responsibility of just checking and periodically say, oh, there's a review, and then
I have a lady in my pharmacy who likes Facebook. I hate the damn thing, but she loves Facebook, and therefore she is. I said, you know, can we put on Facebook X, Y, and Z? And she creates photos, she put messages on there, and it helps also the community to know what you're doing. So that's great. A couple more questions, and then we'll probably call it a day. Initially, when we started the conversation this evening, there was a lot of people in your first sort of put your note in a chat sort of question about all the things, all the advice that we do that we don't get paid for. And I'll give you an example of the pharmacy first for an ear for an adult, for example, or a UTI for a 70-year-old male, or anything like this that wouldn't qualify, as well as people just taking your time just because they walk in and they need advice. How do you address this within your pharmacy? Is it using your staff? Is it skill mix? Do you screen people before they speak with you? What do you do in your business that could help people this evening?
So basically, when pharmacy first started, what I did was run a training session with the staff. So we really, they absolutely love when we have those kind of all staff you know, sort of sessions, because actually they get to see their other colleagues as well. They get to understand context, and everybody sort of knows what role they have. One of the first things that I did was, after the training, was to create a template that is stuck on the screen within the pharmacy tills. So the counter. So when a patient comes in, it's got basically the different age, you know, sort of age groups and the criteria for actually being able to feed into the pharmacy first in the first place. So if the patient comes and they're male and they're not eligible for the UTI, but they've got a UTI, I am an IP, so I can see some patients. So perhaps it's within my scope. They know what services they can mention, the fact that actually you fall out of this, but the pharmacist can see you and you just pay a fee for that. If you can't get a doctor's appointment still, or you can't access 111, or you don't want to wait, then you can book an appointment to see me. So it's about communicating that to them. I have had where the older person has come in because of their ear. I think we've all had this, haven't we? And again, it's about communicating to them exactly what it is. Yes, we do look after ear infections, but unfortunately, you're not within that group that I'm allowed to look after, because there are certain ones that the NHS has said I should be able to look after. However, I do have the skill to be able to look after you. If you want to join in and have this privately, then we can book you an appointment and you can see the pharmacist. One of the things that I've told the staff, and one of the things that I've had to discipline myself to be able to do, is not to turn patients away. You know, try and accommodate those patients who have actually said, you know what, yes, I will pay for this service. And I have had one, and they had two different things that they wanted to talk about. They were very clear, because the staff had already told them that there is a consultation fee. And she said, you know what, I want to speak to the pharmacist about this, but I also want to speak to the pharmacist about that. So they paid for their fee. I did make an exception that actually they were not going to pay 2 consultation fees, but they knew that they were having a double appointment, and they actually did get treated for that, and they were happy to pay for the medication privately. So it's about really communicating with them, but also making time. I think when you make time for the patients, the word will go around and they will tell others what you can do for them. And often they will come in and say, I just want to see you. Can I book a private consultation? That's great. There was a time that I wasn't making time for that because I was too busy, bogged down with other things. But when you sort of upskill your staff, that frees you to be able to do other things. And also it frees them to be able to communicate these services to your patients as well. And it can only get better. It's not going to be 100% from day one, but it gets better.
And I guess it is easier to say no when you're busy checking 1,000 items in a day than it is to say yes. But people have, as we said all night, they've got to make the right decision for their business and what's important and what's going to get them a return. And I've seen a few comments about private services should not prop up NHS services. Trust me, I am in the midst of all this with the government, the negotiation. We're just as much in limbo as everyone else. And I like you, wish that the NHS service that I provide would wash its face. Unfortunately, it isn't at the moment. And this is why some of the private services do help. With regards to pharmacy first, and I suppose I will give you not a bit of an insight, but some information. So you all know that we get paid a consultation fee for Pharmacy First for clinical pathway consultation, or if they're referred by NHS 111 for the equivalent of a CPCS. But there's also, when we hit a threshold of consultation, a down payment, which could be currently is £1,000, but the threshold has changed and has increased. And we also know that some pharmacies aren't reaching the threshold. Some of my pharmacies are not reaching. In fact, last month, none of them did, and the months before, 2 out of 4 did. So we're all in the same boat in that respect. But that payment, however difficult it is to access, was also designed to pay for those consultations that are non-qualifying, and therefore, the problem is not necessarily that you're having conversation with people that are not eligible. The problem which CPE needs to sort out, this is not an NPA matter, this is a CPE matter. The thing that needs to happen is access to that £1,000 monthly payment needs to be made easier. We know that CPE is working hard on that, but we also know that the NHS is making it incredibly difficult. So I just wanted to address this, that, the 35-year-old coming with an ear infection and doesn't qualify actually should be captured in that £1,000 payment. But unfortunately, as some of us have realized, that £1,000 payment is not easy to achieve. So I think that brings us really to a close this evening. Because we've got a couple of minutes, in the event that I haven't asked a question that really someone wanted the answer from either Patricia or myself, I'm going to allow you to come off mute and perhaps ask that question. If you can put your hand up and I can see you. If we've answered all your questions for this evening, but you have some more, you can always reach the services team at the NPA, who will be able to come back to you on a more individual basis. It's a difficult world out there. We know it. And the webinar this evening was more about trying to transition from freebies to implementing charges. And I've read a lot of messages tonight of people who are thinking of doing exactly that tomorrow. My word to you would be, don't be frightened, because the pharmacy down the road that will take your free MDS and will do them, they'll eventually stop, because when they get 200 additional MDS, they won't be able to cope. And then they'll collapse, and then you'll reap the benefit of your patients. You have to be brave. It is not easy. It's not easy to speak to patients about having them to pay for a service perhaps they have had for free for a long time. But it is something that unfortunately will need to be done if we are to survive. The NPA will continue pushing in the media, pushing pharmacy up the agenda so that we'll get debated in Parliament. It was my honor to have you all this evening. Patricia, I'm going to let you maybe a final word. Thank you very much. And I look forward to seeing you. If you want to speak with me, I'm also available. If you contact the NPA, I'm sure I can be in contact with you if anything hasn't been answered. Patricia, one final word, and then we'll let these people go back to their families.
Yes. Thank you very much for giving up your evenings. I know exactly what it's like. I would ordinarily be sitting there probably doing my admin or catching up with them, checking off prescriptions. So I know that obviously you've packed some things to be able to join us, and hopefully it's just giving you some food for thought. It's not all the answers, but it's just really to get us all thinking and really trying to mobilize, because the way that we act will be the way that the commissioners or the Department of Health or the people who make the decisions about paying us will treat us. And we need to demand that we are treated a lot better. And part of that would be respecting and valuing our time. We cannot carry